Right, so slowly let's welcome back our participants from the lunch break. Thank you so much for joining us again. And I'm going to hand over for the next session, which I think everybody is quite excited for, to my amazing colleague Ayşe Gül.
Thank you. Well, we are excited. I hope you had a good lunch and you are all full and had some time at least to relax. I know that it is sometimes hard if it is the session right after lunch, but I can promise that if it will worth every minute of your attention.
Siesta time.
I'm sorry. I know. we needed that. Because, when we first started organizing this two-day event, we wanted children's and young people's voice shaping this whole 2 days. And we reached out to ENIL. And their voices shaped yesterday and today. So today I have a trio of our ENIL's youth network together with us. And I will try to do my best to introduce them as well as I can, because they have many hats. So they will share not only their experiences, but also their expertise with us. Let me start with Catarina Vitorino. She's a PhD student in clinical and health psychology at University of Coimbra in Portugal. She's a disabled woman, and she defines herself as an anti-ableist, feminist and intersectional activist. She's a member of European Network of Independent Living. She's also a member of Board of Center for Independent Living in Portugal, and she is a co-founder of a Portuguese feminist collective of disabled women. Did I do a good job? Yes. Awesome. And then there is Nicolas right next to me. Nicolas Joncour is, how did I do? Okay. Is 25 years old, and he uses an AAC device, and he's a French gentleman. He's an autistic student in a sociology department at René II University, and he is interested in the implementation of CRPD, especially Article 12 on legal capacity. And he also belongs to a French association, Clé Autiste, and he's a member of ENIL youth group. And remotely, Melike is joining us. She has cerebral palsy. She's a law school student at Ankara Social Sciences University. She likes to, when she graduates, she likes to work as an activist and a lawyer for defending people with disabilities rights. She is also a member of ENIL, and she's also the member of Association of Women with Disabilities. This session is about independent living, but before we start our session, I wanted to ask our panelists to tell me about how they think about independent living. Because when we first designed this session, we realized that professionals describe independent living, or parents describe independent living, actually different than young people. So maybe I should first ask Catarina to tell her opinion about independent living, how she describes it.
First, let me thank you for the invitation to be here. It's a pleasure to assist to all the panels during this day and yesterday, but especially today. And it's really interesting to talk about gender violence and violence.
Szépen, hogy itt lehetek.
So for me, independent living is all about giving power to the people. And first, it's a concept that is common for all of us. We all have the right to live independently, but especially for disabled people, we still have to reclaim these rights with more strength, because it's not a right for everyone yet. So it's about deciding about our present, about our future, and our daily living. And independent living arises social movement to requirements to say that we are capable of deciding about our life and about our path, and we have the right to do so. And it also means that we have access to every opportunity that are available for everyone, and disabled people are also entitled to it. But we also need some adaptations. So independent living is also about accommodating the world to everyone and also to disabled people. And we are talking about personal assistance, accessibility, inclusive education. So there are all pillars of independent living that gives us the power to decide about our lives. So self-determination is key to independent living because we are entitled to decide about our lives, but also to decide about the life of our community and our country and the world in general. So it's about self-determination, self-empowerment, and voice.
Thank you. From your response, I will keep self-determination in my mind specifically. Now, I would like to turn to Nicolas, and I will ask him to elaborate on independent living while you are using it, while you are an AAC user, and how it impacts on someone's life when communication is challenging.
I was educated in a mainstream and correspondence school, and used alternative communication devices from a very early age. This enabled me to express my choices, make decisions and learn about the world. It gives me control over my life. But this is not the fate of the majority of disabled children. The fact that I use AAC and need help to use my means of communication impacts my relations with others. As my typing is slow, people don't wait for me to finish typing or they speak directly to my personal assistant. I have apraxia. The brain-body disconnect is something I live each moment. It is difficult for me to get my body doing what I really want to do. I need my personal assistants to be trained in my means of communication and knowledge about self-determination. These 2 points are essential to ensure that I am in control of my life. I live in a university residence. I managed to obtain financial aid for full-time assistance, which is unfortunately not very frequent in the case of cognitive disabilities in France. The difficulty of making myself understood requires me to be supported by people who listen to my needs and have no desire to make decisions for me. I don't need a carer, but people who support me in the way I want. In France, AAC is due to become mandatory in establishments and services by 2027, but we're still waiting for the time when deinstitutionalization will take place.
Thank you. From your contribution, I took two main concepts with me, and one of them is taking taking control over your own life, also making your own decisions. Could you tell me a little more about how to have an independent life when you are not seeing as able to live and want to live independently?
We are all interdependent. No one is truly autonomous. Autonomy is based on society's aspiration to consider disabled people as equal citizens. The ways in which obstacles are removed give disabled people the opportunity to act autonomously, and to take charge of their lives. Non-speaking autistic people face a number of discriminations. People underestimate their abilities. They are prevented from living our lives as they wish. They are excluded from mainstream schooling and have very difficult access to education. They can be misunderstood and mistreated. They feel frustrated because they don't have enough opportunities to express themselves. They are denied access to independent living and advocacy. They are not considered to be able to make choices. In France, I heard social workers and researchers criticize the CRPD and the social model and find non-speaking autistic people's emancipation unworkable and damaging. Non-speaking autistic people are therefore institutionalized, placed under guardianship, supposedly for their own good. But it is not fair to consider them as objects of care or protection before considering them as subjects of law. There are tools and solutions like support decision-making and personal assistant. It's a change of mindset. Incapacity is a social construct.
Thank you. At this moment, I would like to turn to our third panelist, joining us remotely. Melike, would you explain how are you defining independent living?
Although I agree all of my colleagues' comments, I would like to remind all of us the Judy Humans, the disability rights legends, definition of independent living. She says that there is a misconception about independent living, and people only consider independent living for disabled people to be able to do everything by themselves, which is not true. But Judy Human says independent living is not about doing everything by yourself or being independent. It's about just making the decisions and deciding what kind of help do you want, where, and how. So this is, I think, a really important mindset when we are talking about independent living, because as Nicolas said, nobody is truly independent. We live in a community, we live in a society, we are all interdependent into one another at some degree. And maybe, yes, disabled people will need more support and assistance from their personal assistants or their members of community, but this doesn't mean that we don't get the right to determine our own fates and our own jobs, careers, and futures. And also, independent living will enable disabled people to achieve more and go chase their dreams and do wild things when their local support mechanisms like their parents is not enough anymore. When you have professional help hired, you are less limited in the choices you can make. You can say yes to more opportunities, which I think is very fascinating about independent living, and which is the reason I've joined independent living movement.
Thank you. I remember our first conversation when we were trying to organize this conference. I also thought about the things that we have discussed yesterday with the children, about the balance between childhood and adulthood and how they were connected together. So I would like to ask Catarina what she thinks about schools preparing children with disabilities to live independently in the future, especially in the context of special education schools.
Yes. So first, every setting that is separate from the society is seen like segregation, exclusion, and discrimination. So special education is just one example of a segregated facility like institutions. So when we separate a group from the society, in this case, disabled people or disabled children, we are creating a ghetto. So special schools, in my opinion, according to the CRPD, are segregated settings that doesn't prepare children for autonomy, for independence, and for an independent living. And the school is the very first context where we socialize, where we create social bonds, where we have the first love stories. So in this particular setting, we are preparing children for another segregating setting. So this creates a sense of not belonging to the society, a sense of otherness. So we are creating children that are not prepared to live in the community and don't have a voice to fight for their rights, to have dreams, to have ambitions, and to prepare a path and a future for themselves. And we know that in these settings there are a lot of paternalistic approaches and essentialists, and also it doesn't prepare them to live independently and to give themselves a future that is according to their dreams. So it's very important that we create children that are capable of fighting for their own rights and to have a voice in the community and also to contribute to the community just like anybody else. And also develop critical thinking, a personality that is individualized. And this topic about personality and identity is very important for us as human beings. So when we create children in a separate environment, it's like they are not full individuals. They are just created in that separated environment. So it's very important that we create children among other peers, non-disabled, disabled, and also for non-disabled children, it's also very important for them to socialize with disabled people because we create citizens that are more capable of fighting for rights, for human rights, and also to create a diverse world, a plural world that belongs to anyone.
Before I move to Nicola, can I ask you one more question? Because it really impacted me deeply when I first met you. You talked about special education schools and how they don't do a good job preparing children because of many reasons that you have just shared. But you also said that it also impacts a person's relationship with her own self. Could you comment on that?
That's also very important because when we are created in a paternalistic approach and under medical model of disability, and when we are seen as a wrong and a new person, we don't see as ourselves as identified individuality. So we see also ourselves as not normal and not belonging to the society. So this also have an impact in our identity and how we see ourselves. And this also will impact in our relationship with other people because we don't feel that we are lovable enough or capable to fight for our own rights. So when we feel that we don't have a voice, we don't feel that we are unable to have rights. So this will have an impact in our identity and in our place in the world and our voice within the community.
Thank you. After your comments about special education schools, I would like to ask Nicola, because when we were talking, he made a differentiation between life skills and high-level curriculum that needs to be presented to children with intellectual and psychosocial disabilities. Could you please explain what do you mean by that?
A lot of disabled and particularly speaking disabled children in France live in institutions and have no instruction. Intellectual disabled people are infantilized. They are not seen as people able to learn rich and complex educational material from childhood. Cognitive, intellectual disabled people are considered like big children all their life. They are often offered nothing more than programs to develop life skills. ABA applied behavior analysis, that is often used for autistic children, is a way to control behaviors, not one's life. The particular interests of people with autism should be used for our own development and not be considered as a nuisance and eradicate. This is not in accordance with the CRPD. AAC is really important to improve communication and social participation. But this should not limit what the person wants to express. I heard about a mother of an autistic child who had deleted the word helicopter from the means of transport section of her son's communication tool, assuming that he would never have to use it. Presuming competencies is required very soon to prevent people from dying without discovering knowledge of the culture of humanity. Neither inferior nor animals, treating them as equals.
Thank you. We both see you and also your personal assistants on the stage with us today. Can you tell us a little bit more about having a PA and living with your family and also living independently?
In France, even though there have been laws in favor of disabled people, and even though France ratified the CRPD in 2010, it is not really implemented. There is always a gap between what is announced and what happens in reality. Access to personal assistance is not easy, and very often people do not have enough hours and the remaining costs are high. Financial aid is inadequate and the procedures for obtaining it are long and difficult. Personal assistance for people with a cognitive disability is difficult to obtain, and in reality there is no demand for it as most of them are institutionalized, deprived of their right to education, their right to freedom of movement, and their living conditions in a segregated environment make them vulnerable. Children should live in their family, with personal assistance. In France, some parents choose to institutionalize their children, and it's not always due to a social or economic problem, it is cultural. Personal assistance should be a way to control one's life and you should be able to choose your path. To have a member of the family as a par may put you in the position of eternal child. But family may help managing the par team.
Now you mentioned that having a family member who is also your personal assistant keeps you as a kind of child all the time. I would like to move from childhood to adulthood a little bit, and I would like to turn to Catarina and ask her to tell me more about developing as an individual and having an individualized personality as a woman.
So I think that personal assistance has a powerful impact in my identity when I started to have my PA. So I think it's one of the most powerful tools of independent living because it gives us the opportunity to decide about our lives, and it also has an impact in our internal world, but also in the external world, because we are exploring our identity, but we can also explore the world that we live in independently and not depending on our friends or our parents. So when I joined independent living movement, after I started to have PA, my future, who I am, what I want to be in the future, and I can have not only dreams, but now I can have ambitions too, because I can prepare my path for the future, and I can have an impact in my community. So I started to join activism and started to join different movements, different social movements, not only disability but also the feminist movement. So this is the core importance of personal assistance, because we can be whoever we want without depending on other people, without having to equilibrate our lives with our mothers or parents in general, our friends. And as historically a group that has been marginalized, personal assistance is very powerful and transformative for us, because we feel that we belong to society and we can have an impact in our community because we can decide about our lives and we discover our voice with the assistance, but not with the system, but with the concept of PA and with the concept of independent living. And I think it's very important to distinguish personal assistant and a caregiver, because with a personal assistant, we can decide first who is the personal assistant, when she or he will do the activity with us, where, with whom. So it's very important that we are active users and not just passively receiving care. So this is very important, and this is the core concept of independent living, that we are the active users of the service. So by this concept, we can develop our identity and develop that sense that we are capable of fighting for our rights as well. And this is very important, because when we are depending on other people, imagine a non-disabled people, a non-disabled person. When you want to fight for your own rights, you can go to the streets and reclaim your rights. Disabled people depend on other people and on accessibility and on accessible transportation. So we are denied the opportunity to also fight for our own rights. And personal assistance give us the power to do so and the tools to do so.
Catarina, relationships, our sexuality is also part of our adult life. Would you like to comment on those shortly as well?
Yes. So sexuality has been an off topic for disabled people, because we are seen as or desexualized or hypersexualized. So society doesn't see us as attractive, as sexy or lovable. So sexuality is an important topic for disabled people, especially when we are women. Because as we heard during the morning, women with disabilities are more likelihood to have violence against them, or to be sexualized, or to be violated against them. So it's very important that we have sexual education for us to know about consent, what is abusive touch, and this is very important, especially in institutions, because it's one of the most probable settings that we are violence. We have violence, so it's very important that we teach and that we learn with each other what is an abusive touch and what is a sexual abuse, because we know that very often when disabled people tell about violence or about a particular moment they are abused, they are not believed. So our voices are not heard. So it's very important that we teach about consent and also that we talk with the community and with society about sexuality and about sexual life of disabled people and disabled women, and also to learn with each other what this means.
Thank you. I would like to go back to the topic of having a personal assistant, and I would like to turn to Nicola. Nicola, could you tell me how can you be a PA employer while you are seeing, while your legal capacity is questioned?
Personal assistance helps me to lead the life I've chosen. It also enables me to study at university. It allows me to travel, to take part in international community events. I can follow my own path. Expressing yourself and making your own choices is a fundamental right for everyone. As I said, most of intellectual people live in institutions in France and are on guardianship. When I go to the dental center that is part of the public hospital, I go there because the care is appropriate. If I am supported by my family, they are systematically asked to sign the authorizations for treatment, as if it were obvious that I was under guardianship and that they were my legal representatives. I recruit my PA in a spirit of empowerment. Finding PA is difficult, but even more when they have to subscribe to the logic of supported decision-making. I understand the ups and downs of being an employer. I need to be vigilant about labor legislation. I'm very careful not to put myself in danger. My assistants can take me to court. And as I am not under guardianship, I'm afraid of being reported. And that would be the end of everything. Even if I'm more protected than some thanks to my student status and the fact that I can express myself, others are not. Some are less able to get PA and to decide on their lives, as their families don't think it's possible because of a deficit-based mindset or because of all these legal and administrative difficulties.
Nicola, you are an AAC user. You also have a personal assistant. Then can you tell me how can the confidentiality of private exchanges be guaranteed?
I need help to use my communication devices, use the mouse plugging my devices, navigating on internet etc. as I am dyspraxic. I have to trust the people who help and support me in my daily life.
Thank you. Melike, now that we talked about legal capacity and things like that, can you tell me a little bit more about the legal barriers that individuals with disabilities have to overcome to live independently?
Yes, absolutely. First of all, as Nicola mentioned, persons under legal guardianships in some countries might not be able to form a contract. That also would mean that they wouldn't qualify to be employers, and that would go for their personal assistance as well. But also, as someone who has experience and who has a loved one was placed under legal guardianship, and I know if we do not change these oppressive systems, sometimes people who are legal guardians with bad intentions could become violent and could harm the disabled person that they were supposed to support and protect. So As European countries, we need to be in line with the CRPD, and we need to be in line with the European Convention of Human Rights, and we need to change the legal guardianship systems with the supported decision-making systems, which Mexico has already ratified, and the United States of America is in the process of discussing supported decision-making processes in a Senate hearing. And I really want to say that we need help of non-disabled people to be allies with this matter in us. We need everybody believing us that we are capable of making decisions when adequate support provided. And it doesn't mean that we should not have a legal say and a legal voice in our lives. To be able to employ personal assistance, yes, we might need training to be provided to us. We might need legal advice from an employment attorney, but this doesn't mean that disabled people cannot be employers of their own personal assistance, nor they need to be placed under legal guardianship. We always must strive to have environments that will support disabled persons to make their own decisions, but professional help always must be set in place, and legal aid always must be available, and we must definitely oppose institutions and their harmful and violent policies against disabled people. We should start our fight in independent living by shutting down all of the institutions across Europe, then providing legal assistance and personal assistance systems to persons with disabilities. And I'm sure from there we will reach our goal of being independently, living with dignity in community. Thank you.
Thank you, Melike. We have only a couple minutes before I ask for their last words, but I would like to open the floor to you if you have any questions.
Thank you for the wonderful interventions. I'm learning a lot. My question goes to Catarina specifically, because if I understood correctly, you founded a cooperative in Portugal, right? Can you tell us a little bit about that experience, about how cooperative works?
It's a feminist collective of disabled women. So we are among the first collectives of disabled women because I am a member of Center for Independent Living, and we fight for independent living in Portugal, but we address not only but especially ableism and disabled people's rights. But then we started to work with the feminist movement and organizing meetings with feminists, and we felt that there was a gap in the feminist movement about the reality and the experiences of disabled women. So we felt that we had to do it. So about 4 years ago, during the pandemic, we founded the Defiance as the Int. It is a collective. We are only 5 people for now, but we are already doing some changes in different social movements. But because with this particular collective, we are working with different social movements, with the feminist movement, with the queer movement. So we are organizing the protests, the marches, the feminist march, the Pride March. So within these 4 years, we already started to see some changes, small changes. For example, the path of the marches has been changing because of the accessibility. We are starting to see other people talking about accessibility and about the reality of disabled people. So it's very important for us, the concept of intersectionality, because we strongly believe that this is the future of our society, because we know of the history that when social movements are together, we are stronger, and human rights develop faster. So we are trying to do that job in Portugal, and we are seeing a little bit changes, so we are proud.
I have way more questions, but I gave opportunity for everyone else.
And I feel like I have to stay true to our timing, but I know that Nicolas had a couple last words that he wanted to add.
In France, disabled people are not well represented and therefore play little part in consultations on legislation and public policy. It is mainly the management associations that make their voices heard. The UN Convention on the Rights of Persons with Disabilities is not well known by jurists and political decision makers. What I'd like to see progress in terms of law in France is legal capacity. Since 2019, people under guardianship have been able to vote, but it is not enough.
Thank you. Thank you for joining us, Melike. Thank you, Catarina.